welcome to my YouTube channel. For those of you who don't know me, my name is Clemmy and welcome. Guys, today I would like to talk about signs and symptoms of breast cancer. Just for those of you who don't know, I'm a breast cancer survivor. 2 years out since my diagnosis. I was stage 3 breast cancer. I had a mastectomy, so at the moment I have my right breast, amputated, and I had lymph nodes took off in my armpit. I had 5 lymph nodes removed, and 3 of them tested positive for cancer. So that put me at a stage 3 category. My cancer, sorry about that. I won't say my cancer because really and truly it's not my cancer. I'm not going to claim it. The cancer I was diagnosed with was at stage 3, and it was HER2 positive and ER positive. ER means estrogen, so it was very high in estrogen. So that means my body is producing too much estrogen. So at this moment, I am on um, anti-hormonal blockers, which is I'm on tamoxifen. I take tamoxifen once a day, and I also have monthly, Zolodex shots. So I take these shots every month in my stomach to shut down my ovaries. These Zolodex shots, they're very expensive. They're over $500, and I have to get that every month. Okay, guys, so let's go back to the signs and symptoms of breast cancer. So in case you might see me looking away from the camera, it's because I have some stuff written down and I don't want to miss anything. So, guys, signs and symptoms of breast cancer. First, you do your breast check exams. Like I say, you put your hands up, you took the 3 fingers, you go in, into your armpits, in your neck, and the same thing. You lie down on the bed. You make sure you do that at least once a month, 10 days after your monthly cycle. Okay, guys. Change in your the breast. If you see the breast look like the peel of an orange, if it has dimples, if it's kind of red, that is something that's a bit concerning. If your nipple have nipple discharge, if you have bloody nipples, a liquid, if you're not lactating, if you're not breastfeeding, there should be no discharge coming out from your breasts. So if there is any discharge coming out, this is reasons for concern. Get it checked. If your nipples is inverted, if all of a sudden you see your nipple is inverted, or you have like a rash on your breast, that it's a reason to get it checked. Okay, risk and factors for breast cancer. It could be they don't really know what's the risk of breast cancer. Before they were saying women of an older age, over 50, are prone to getting breast cancer. But now women at the age of 18, 20, young women are dying every day from breast cancer. So dense breasts. If your doctor has ever said that you have dense breasts, or if you know that you have dense breasts, that's a high risk for getting breast cancer. So because of the dense breast, you should be having a mammogram every year. Family history. Although family history plays a small percent of it, because most people now that have breast cancer never had a family history. So family history is a bit of a concern, but it's not really of a high factor. I had no family history of breast cancer. Another factor for breast cancer is if you had early stage cancer before, and sorry guys, and the cancer returns. Almost 50% of people that have been diagnosed with breast cancer in their lifetime, sometimes they get a recurrence. Not all of them, not all of us. some of us. One thing I want to share with you, and I was really happy when I spoke to my medical oncologist. I asked her, doctor, so are you saying that I am cancer free now? And she said, to be honest with you, I never tell my patients they are cancer free. I said you are NED, meaning no evidence or disease, or you in remission, because there's no such thing as cancer free. When cancer hits your body, there's no such thing that you can be cured, but there's a possibility that the cancer can come back. So, things we should do to keep cancer at bay, we need to keep moving, exercise our body, do our daily exercises, even if it's half an hour walk, guys. It's good to do. Go out, take half an hour walk in the morning or half an hour in the afternoon. If you can do an hour, sorry, do an hour. But listen to your body. Get up, move, do stuff for yourself. Another thing to do, which I have taken up from the time I was diagnosed, is juicing. I do a lot of juicing. I do my green juices. I do beets. I juice carrots. I do that. And eating dairy products and meat and chicken and all of those things, we should, I know it's hard for us to stop it, but we should limit it. For those of us that still do, we should limit it. Especially those with that, because those animals are fed with hormone products, and all of those hormones we ingest it when we eat them. Okay, guys. So the next thing I want to talk about, and I'm going to make another video about it, is what a few things that helped me during radiation and chemotherapy and radiation. A few products that I used. I want to show you few things that I used whilst going through chemotherapy and radiation. Okay, guys, I think I will end this video right here because I don't want it to be too boring and I don't want it to be too long. So I hope this information was informative enough for you. At the end of this video, I will put a few pictures of breasts that looks like they have a dimple or they have the liquids, and that's little stuff that you should look for. Okay. And next thing, guys, be kind to yourself. I know when you get a cancer diagnosis, it is mind boggling. You feel like you're going to die. You think like that's the end of life. And people tell you, don't eat this, don't do that, leave sugar, don't. Just listen to your body, guys. When you're going through chemo, like I told you, you just have to do you until after. Okay, guys. So for those of you who have not yet subscribed, what are you waiting for? If you're watching that video, that means you're interested. So give me a thumbs up, like the video, guys, share the video, and see you on the next video. Bye bye, guys.